are all welcome. Professor Tanon, over to you. Thank you.
Thank you, Mr. Budea, Luca. Good day to everyone. I'm Professor Tanon. I work at the Infectious and Tropical Disease Department of Félix Houphouët-Boigny University in Abidjan. I'm the moderator of this session, and let's start now. It's my pleasure to introduce the president of SAR, Dr. David Pagwesese. Is going to address you welcoming words, please.
Thank you very much, Professor.
Thank you.
Thank you very much. I really am delighted that we are having this webinar today. And I want to say to you, dear participants, and you, Professor Tanon, who is the moderator, this webinar is one of the first activities assigned that SAR, or the Society for AIDS in Africa, wish to deliver to their constituency. We are indeed honored that Professor Morenike Ukpong, Society for AIDS Africa in Africa Treasurer, in spite of a very tight schedule, is delivering this session on how to write abstracts. And SAR will continue to strengthen this type of workshop for new researchers in line with our strategic plan 2023 to 2027. How to write abstracts webinar becomes necessary, as over the years, we've noticed that the quality of abstracts received from 2015 ICASA to 2021 ICASA in Durban, the standards have somewhat dropped in terms of quality and in terms of content. Hence, the decision to strengthen and give skills and opportunities to young researchers in Africa. We believe that you will enjoy this first workshop, and we look forward to welcoming you in Harare on the 4th to the 9th of December 2023 at the International Conference on AIDS and STIs, ICASA, in Africa, to further this session that we've already started. I would like to use the opportunity to call on all governments in Africa who celebrated this year's 60th year of Africa Day to kindly try, despite their priorities, to increase allocation budget for research in their various countries. I will conclude by encouraging our heads of state, all of them in Africa, to invest very heavily in education, into research, into health systems, and into food security, which we hope to give us a true independence of ourselves and be non-dependent as Africa on this beloved continent of ours. With those few words, I really wish to officially open this very, very important webinar, and I wish Professor Tanon, I hand over to you again.
Thank you, Mr. President. Thank you for these welcoming words. Now let me introduce our speaker of the day, Professor Morenike Oluwatoyin Folayan Ukpong. I think it's the best pronunciation. She works with the Obafemi Awolowo University as Professor of Pediatric Dentistry. She is a board member of Society for AIDS in Africa, the chair of the Heartland Alliance Nigeria Board, and a fellow of the Nigeria Academy of Science. So, Professor Morenike, you take the lead
very much
for now.
Thank you so much. And thank you, everyone. Thanks for those that registered. Thanks for being here. And thanks to SAR, Society for AIDS in Africa, for making this possible. Once again, the reason for this abstract writing session is to enable our early career researchers learn a little bit about what we expect from their abstract submission for the Society for AIDS in Africa by annual conference known as ICASA. ICASA abstract submission is open, and it's open until the end of July. We would be looking forward to receiving your abstracts. In the next few minutes, I will take you through what is expected of you. I will be spending time on this webinar from the point of view of a reviewer. What do we look for in an abstract? And hopefully this should strengthen your writing of an abstract. We do know there are many reasons why we write abstracts. We write abstracts for conferences, for manuscripts, for dissertations, for book proposals, and for grant proposals. The principles for writing these abstracts are all the same. The content may just differ. For example, if you're writing an abstract reporting on a proposal, there might be sections in that as opposed to writing an abstract for a manuscript or a conference. If you write an abstract for a grant proposal, you would not expect to find results and conclusion. In a conference abstract, you would definitely be looking out for results and conclusion. So when we talk about conference abstracts, we refer to research-driven abstracts. And research is really powerful because research answers unknown questions. They solve real-world problems. Abstracts may be, once again, for conference presentation or manuscripts. Abstracts usually would report on completed work when it comes to conference abstracts. Manuscript abstract may report on what is ongoing or what you plan to do or what you propose to do. For most parts, conference abstracts would report on completed work. And it may be work that generated its data by qualitative research or quantitative data collection. It also may be both, so you could have mixed research design. Whatever it is, your abstracts are welcome at the ICASA conference. We would expect that your abstract highlight research findings or lessons learned. ICASA conference abstracts usually do not accept all abstracts on ongoing work. At ICASA, we expect you to share with us an abstract of a work you have concluded. Conference abstracts may become structured or unstructured. When it is structured, you're expected to write an introduction section, a method section, a results section, and a conclusions section. Even when it's not structured, you would see this 4 components without a subtitle. If you're reflecting on field experiences, there's still usually an introduction and a methodology. But rather than results, you will be sharing lessons learned and you'll be making conclusions. ICASA would expect us to submit both research work and abstracts on field experiences. Usually for the ICASA conference, we expect you to submit abstracts that are structured, which means you highlight your introduction, your methodology, your result, or lessons learned if you're sharing field experience, and a conclusion as its content. When we talk about the introduction of an abstract, what is it that we usually look forward to? We usually would look forward to in the introduction, otherwise known as the background, at least 2 statements. One statement or sentence, which is enough to highlight the gap of the study or the problem your study is trying to address. The second sentence highlights the study objective or objectives. In a well-structured abstract, all you need in the background are just 2 sentences that highlight these 2 issues. Once again, the first issue is the gap that your study is trying to address, and the second is the study objective. We'll spend a little time now on the objective because this matters. Anytime you write an objective, it starts as the building block for your study. And any reviewer is going to review the entire abstract based on what your study objective says. Your study objective is the determinant of every other piece that goes into the abstract. When we talk about an objective, we would expect your objective to be SMART. I'm sure you all know that SMART is an acronym, with the S standing for specificity, M standing for measurability, A showing is an achievable objective, R standing for reliability, and T showing that it's time-bound. When we refer to specificity, we're talking about precision. Objectives are expected to be precise. It's not supposed to be a vague statement. Together, let's review the statement. So we have an objective that states that we want to determine the association between a socio-demographic profile of females and their menstrual cycle. We reviewers will determine that this is not a specific objective for a number of reasons. First, the socio-demographic profile. We do know that over 56 socio-demographic profiles that you can investigate in an individual. We are certain your abstract will not be exploring all the socio-demographic profiles there are, and therefore not being clear about the socio-demographic profile you intend to investigate makes it not specific. The second non-specific element in this objective is females. We have females ranging from 6 years old, infants, toddlers, preschoolers, schoolers, adolescents, young persons, adults, and elderlies. Your profile, this objective has not made us understand which group of females you will be dealing with. Finally, we have no idea what country the study is being implemented. Is this a global study? Or is this a Nigerian study? Or is this a Ghanaian study? For these reasons, we find out that we, as a reviewer, will find this an unspecific objective, and it becomes very difficult to reflect on your methodology using the lens of your objective. The next thing we want to look at is the measurability of your objective. When we say measurability, we expect your objective to draw boundaries around what it's exploring. We should be able to identify what are the explanatory or, outcome variables. So let's look again at this objective. The objective says it wants to identify the relationship between socio-demographic profiles of females and their menstrual cycle. Once again, there's clarity about the fact that socio-demographic profile is not specific, females is not specific, and also the fact there's no Nigeria is not specific. But now there's a new dimension to this objective. It's not measurable. What's not measurable about this objective? There is no instrument with which you can measure the word relationship. There are different types of statistical relationships. You can have an association, you can have impact, you can have effect, you can have trends, you can have correlations. Those are all forms of relationships that are measurable statistically. Stating relationship here makes this objective unmeasurable because we do not know what statistical analysis you are proposing. When we now want to talk about achievable, we have a problem. When you say achievable, what you want to do is practical and doable. The reviewers want to see that that objective is possible. It's researchable. Let's look at this objective. This individual researcher wants to measure the impact of age and ethnicity on the menstrual flow of 15 to 19-year-old females in Nigeria. This abstract passed the specificity score. It is exploring its variables among 15 to 19-year-old females. That's specific. This work is being conducted in Nigeria. That's specific. It's not looking at socio-demographic, but age and ethnicity. That's specific. It's also measuring impacts. That's measurable. However, there's consideration that this objective is not achievable. And why? In Nigeria, when you're looking at ethnicity, you're going to deal with over 300 different types of ethnic groups in Nigeria. And therefore, if you want to measure impact of age and ethnicity for the study population, you're going to be there for another 5-10 years. So ethnicity is a challenging thing to do within the context of Nigeria. Not impossible, but definitely something that was daunting and definitely challenging to achieve in the context of Nigeria, knowing that Nigeria is dealing with over 300 ethnic groups. The other thing I want to highlight here is the use of words, statistical terms. When you choose to measure the impact of age and ethnicity on this population, anybody who is research-oriented will know that this must be a longitudinal study, not a cross-sectional study. You cannot measure impact by collecting data at a point in time. You also will not measure impact.
Hello,
in a study.
Sorry, you are going too fast. The translator
Okay.
can help with you. Thank you.
Thank you. Thank you. I'll slow down. Thanks for letting me know. The second thing is that impact is a longitudinal measure. You cannot measure impact by collecting data at a point in time. Impact implies that you are collecting this data over 3, 5, 10 years, a minimum of 3, ideally a minimum of 5. These are things you see in an objective, and then there's consideration about how you want to achieve this. The next thing has to do with reliability. Reliability refers to consistency. When something is reliable in science, you must demonstrate in your methodology that there's a consistent way you are measuring the phenomenon you are dealing with. You might want to measure the phenomenon using a questionnaire. What we would like to see in your methodology is that the questionnaire is reliable and valid. Whenever you create a new questionnaire, then you have to have shown that that questionnaire is reliable and valid. There's a whole science to ensuring that your tool is reliable. Let's look at this objective. The researcher wants to assess the association between dress codes and mood changes of adolescent females during their menstrual flow. You agree with me that this should be a measurable objective because it's clear that it's an association this individual wants to establish. It's specific because they are dealing with adolescent females, and whatever is happening is during their menstrual period. However, they want to measure associations between dress colors and mood changes. I am sure you would agree with me that measuring consistently dress colors, it's a challenge. For females here, you know that our colors range from magenta blue to sky green to coconut red to pepper brown to oceanic green and, or emerald red dress colors. may not be measured consistently if you are working on the subjective. Mood changes may also be challenging to measure. There might be psychometric tools that may be able to capture mood changes. But when you do not have such psychometric tools, to be able to measure this reliably will become a challenge. Finally, when you look at objective, you expect there to be something time-bound. And we'll be seeing how we review this in the methodology. I'm going to take a critical look at this example of this objective. This researcher intends to conduct a systematic review of the effects of climate change on the menstrual flow of 15 to 19-year-olds and adolescents. This is very specific objective because you know what it wants to do. It's measurable because it's a systematic review. It's also measuring the impact effect. However, that's not time bound. I'm sure you all would agree with me that climate change started from the beginning of the creation of the world. So what time is the scoping review or systematic review going to cover? Without defining the time bounds, there is a problem with this review. I repeat that once objectives are not clear, you leave all the interpretations of what your methodology should be to the whims and caprices of the reviewer. I would then be left to assume what you want to do. Your objective should be clear about what you have done. And then the reviewer can assess your work based on what you have done. Once the objective is not smart, it becomes challenging for the reviewer to actually have a frame with which to assess your methodology. Now we move to the methodology. When you get to the methodology, there are 6 pieces of information at the minimum that should be there. Remember, your abstract has word limits. Your word limits matter. The biggest chunk and the biggest part of your abstract is your method. And you will see how scores are, allocated. Your methodology gets the main score. Your background gets very little score. Out of a score of 5, your background may get 1 mark. Your method gets 3 marks. Your method is the big thing, and you must give the time and allocate space for your abstract. At the minimum, your abstract should open with a statement on the study design. Is this a cross-sectional study? Is this a clinical trial? Is this mixed method research? And then you must include information on the target population. You must include information on the study location. Is this in Nigeria? Is this in Gambia? Is this a global study? Is this adolescent? Is this key populations? In addition, you should include dates of when the data was collected. We can only adduce the appropriateness of your study finding based on time relevance. Things that happened before COVID is not the same as things that happened after the COVID period or during the COVID period. So data when the data collection is very important. It's very important that we're clear about your study variables. What are your dependent, what are your independent, and what are your confounding variables? They need to be spelled out clearly so that any reader will be able to make sense of the results you will be sharing. And finally, what is your data analysis tool? If you are conducting an inferential analysis, we would like to know what kind of regression analysis you did. Is it a binary? Is it a linear? Is it a multivariable? Is it a multinomial regression analysis? We want to know. So that tool has to be there. Once again, these are the things at the minimum that you will be expecting to see in the method. Ensure this is comprehensive because the bulk of your scores goes to the methodology. Next is your results. We will be looking for information on your sample size in your results section. We would be looking for univariate descriptions on your variables that you studied. You already defined your dependent or independent variables, otherwise known as your outcome and your predictor variables. We would expect you to share with us the univariate information, the distribution, the means of this variable. We would also expect that you share with us the outcome of your inferential analysis. Please note, and I emphasize here, that when you're sharing the results of your inferential analysis, please include the figures. For ICASA abstract, we want the figures. There might be conferences or manuscripts that says don't include figures. For the ICASA abstract, we want to know figures. So if you had an adjusted odds ratio, please let us know what the value is. If you had a confidence interval, let us know what the value is. If you generated a p-value, please let us know what the value is. If you generated a mean, let us know what the standard deviation is. Without these figures, your results loses its power to convey a message. Once again, please ensure that the result addresses the study objective. This is not the place to start reporting results that you think are of interest to you. Report what you answer the study objective. And then you conclude your abstract by writing 2 statements: the answer to your study objective and the recommendation based on evidence, not recommendations based on assumptions, recommendations based on the evidence that you have generated. It is only usually your title comes last. When you're writing your abstract, you would have done this, you would have an assumed title. But when you're working through writing your abstract, the best thing is to write your title last. And your title shall include information on the study design, the study variables, your study population or location. Typically, a manuscript abstract is a lot more stringent. For a conference abstract, you can tweak this information to make it a catchy title. A catchy title is very important for your conference abstract so that people at least would want to see that and may want to visit and understand what the content is. This might be the attraction for anyone to come for your session. But as much as you tweak and make it catchy, please ensure that at least it retains key information, including the study population, the location, the variables you study, plus or minus the study design. I will then go on into how to write and the things that matter that can strengthen or weaken the abstract you write. When we deal with abstract, we're dealing with science, and science is precision. When you write a phrase and it's subjected to multiple interpretation, then there is no precision about what you're saying. You therefore have to be careful and pay attention to both the choice of words and the arrangement of your words. We at SA, the Society for AIDS in Africa, would want to encourage every one of you that you all can be geniuses at writing abstract. It's a skill, and skills are acquired. You're not born with skills, you acquire skills. And for writing abstract, it's akin to acquiring the skills like you acquire skills for logic reasoning or crossword puzzles. you have to learn how to play with words in a way that you write a story that is beautiful to read and it's not difficult to communicate your opinion. In other words, when you write an abstract, you mean exactly what you mean, neither more nor less. Just like Humpty Dumpty will say, when I use a word, it means just exactly what I mean, nothing more or nothing less. I'm going to use these two examples to illustrate what I mean by this phrase. When a researcher writes the title and says, I'm determining the prevalence of jaundice in preschool children in Nigeria, one would assume that this researcher determined the nationality of the students, and therefore, amongst this population, this individual only picked out those who noted they are Nigerian by country of origin. But many times, this is not what we did. What we do is that we did a study in Nigeria. In effect, what we actually did was determine the prevalence of jaundice in preschool children in Nigeria. This is precision that we're talking about. I would also look at the second example. This is a lot also about precision, but also about using non-stigmatizing language. The first says you determine the risk of cancer in HIV children. There is no HIV children anywhere. What we have are children with HIV. The study most likely determined the risk of cancer in children with HIV, children living with HIV. Not only was the first statement not precise, it was also using a stigmatizing language. To avoid the use of stigmatizing language, you have to operate the principle of people first. I repeat, people first. There are 340 participants online now. Please repeat to yourself, people first. When you do people first, you will eliminate the use of stigmatizing languages. And let's go on in terms of the way we use words. As much as possible, please avoid biomedical jargons. There are words that may read well for your profession, but it's not communicating the same thing to everyone. Do not coin new words. Minimize the use of acronyms. You ideally only use acronyms and abbreviations after you have used it 3 times. After you've used it 3 times. Also avoid the use of biased language. It's sensitive and it's judgmental, and we're working in a world where judgment is an issue. Let's look at some of those judgmental languages. Using man to infer all human beings carry implication. It's not as accurate as being gender neutral. Rather than say mankind, why not say human race? Rather than write policeman, why not police officer? Rather than write chairman, why not chairperson? Please be conscious of using gender-neutral terms when you are communicating with us in your abstract. It is also very important that your language must not show discrimination, must be devoid of discrimination. When you're writing about marital status, sexual orientation, racial and ethnic identity. For example, when you label normal girls versus lesbian girls, are you connoting that lesbian girls are not normal people? Avoid such dichotomy. One of such dichotomy are innocent children. Are there children that are not innocent? Once again, avoid such dichotomy terms. Another dichotomy terms that it's safer to avoid are the terms that lends people to a them and we dichotomy. They are sick, they are lame, they are disabled. If you learn the principle of using people first, you would avoid the use of these dichotomy terms. Rather than saying they are sick, say people with immune defects are always sick. You've conveyed the same meaning without using a dichotomy that makes one feel inferior or superior. What I'm trying to convey here is that the difficulty is not to write, but actually to write what you mean. It takes a consciousness in writing what you mean. You cannot write an abstract at the last minute and not think it's going to be error-free. It takes you to write your abstracts, share it with peers so that they can help screen and ensure that these issues we're talking about is screened out and you can send in an error-free abstract. Such errors include the use of grammar and numbers and punctuations. This is an example of a punctuation issue. A professor asks, punctuate this word, a woman without a man is nothing. The man wrote, a woman, comma, without a man, comma, is nothing. While the woman wrote, a woman, colon, without her, man is nothing. Once again, this is the same words. Two groups of people have punctuated in different ways. Once you send in an abstract and your abstract is subjected to more than one interpretation, there is a problem with the use of words, grammars, and punctuation. Punctuation is everything, and it helps structure the relationship within your sentences. Now we are going to do something together. Many times when we go for abstracts, when you submit abstracts, we reviewers are required to grade them in the range of 5 marks. Sometimes we do 5, sometimes we score 10, sometimes we score 100%, sometimes it's 6. But when it comes to whatever range, we grade often in this form. Remember your background, you need just 2 statements. The statement of problem, which is 0.5 marks, and an objective, which is 0.5 marks, and the background is called 1. The methodology takes the chunk of the marks, and it's 3 marks. Your design is 0.5 marks, your population is 0.5, the location is 0.5. The data of data collection is 0.5. Highlighting your variables 0.5 and highlighting your analysis is 0.5. That score sums up to 3 marks. Your result is 1 mark and your conclusion is 1 mark. Remember, once again, the content of your results, you should tell us what your sample size is, and your conclusion is just 2 statements. Now, I'm going to call 2 of my colleagues to work with me along with you. We're both going to review this abstract in the next 10 minutes, and you're going to score based on the scoring criteria. So we have with me, I'm introducing Mr. Luke, who's going to pull together your scores for abstract A. There is somebody called A that submitted an abstract. And Gordon is here, is going to pull together the scores for somebody called B, who submitted an abstract. So for this individual, both A and B, this is their title, and this is the background. Remember, you're going to score them 1 mark. 1 mark. Please put your marks in the chat box. Luke is going to harvest, and Gordon is going to harvest. The title of this abstract is Community Perspectives on Barriers and Challenges to HIV Pre-Exposure Prophylaxis Access by Men who have sex with men and female sex workers access in Nigeria. Please notice that there is no abbreviation in the title. Avoid the use of abbreviation in the title. They both wrote, A and B both wrote, this is their background. Men who have sex with men and female sex workers have critical needs for effective HIV prevention tools. One sentence for the background. Very good. The aim of the study was to identify the perspectives of MSM, FSW, and policymakers on the needs for, barriers to, and challenges with pre-exposure prophylaxis, and the logistics required to support the rollout of PrEP for MSM and female sex workers in Nigeria. The second sentence defines the study objective. Please score this background over 1. What is your score? Please put it in the chat box. Luke and Gordon, please address this. So this is A, who is written is method or her method. A's method reads, qualitative and quantitative data were collected through a cross-sectional study. The quantitative data were collected through online survey for 519 MSM and female sex workers. The qualitative data were collected through 22 focus group discussions with 114 MSM and 80 female sex workers, and a 2-day consultative workshop with 65 participants. 2 open-ended questions in the online surveys were a source of qualitative data. Results of the quantitative data were described descriptively. The qualitative data were inductively examined with a content analytic approach to construct descriptive categories. The findings from the quantitative and qualitative responses were triangulated. All right, so one of the things, let's review this methodology. There's the study design there. It says you're doing a qualitative and a quantitative data through cross-sectional study. There's a problem there because you cannot do qualitative data collection with the cross-sectional study. So you might have a problem in terms of defining the study design. 2, do you have any information about where the study was conducted, the study location? It's missing. 3, do you have information about the target population? You can deduce that it's MSM or female sex workers, but there is no information about the policymakers. Let's go back to the objective. There are 4 objectives. There are 4 variables you're looking for. You want to look at perspectives of MSM, female sex workers, and policymakers. You find MSM and female sex workers. In the methods, you cannot find policymakers. It's looking to identify the needs for, barriers to, challenges with, and logistics required. How were those 4 variables measured? Can you find them in this method? The answer is no. The third is, what is it? How did you analyze? The qualitative data was inductively analyzed, but you don't find out how the quantitative was analyzed. Is there any? Yeah, so you're missing out on data tools. When was this data collected? What year? You're completely missing out. So although this method has multiple information, you're missing out on data. Let's look at method for Mr. B or Mrs. B, subject B or researcher B. This is the method. And I read, this was a mixed method that collected data from MSM, female sex workers, and policymakers between June and September 2020 in 6 states, selected from each geopolitical zone in Nigeria. An online survey was administered to MSM and female sex workers to identify the perceived need for PrEP and barriers to accessing PrEP. 3 focus group discussions were conducted with MSM and female sex workers in each state, and 2 consultative meetings were conducted with policymakers to explore causes of challenges with access to PrEP and the logistics needed to roll out PrEP for MSM and female sex workers in Nigeria. A descriptive analysis was conducted for the quantitative data. An inductive analysis was conducted for the qualitative data to construct teams. And then the two quantitative and qualitative responses were triangulated. For this method, did you identify the study design? Yes, it's a mixed method. Did you identify the study populations? Yes, MSM, female sex workers, and policymakers. Did you identify where the study was done? Yes, 6 states in Nigeria. Did you identify when the data was collected? Yes, June and September. Did you identify how the variables were measured? Yes, very clearly explained how the 4 variables were measured. Did you identify how the analysis was conducted? Yes. Descriptive analysis were conducted for the quantitative, inductive analysis for the qualitative, and then it was triangulated. So researcher B had all the 6 variables you're looking for in the methodology, and it's exactly the same with that of A. One of the things you would notice that is different between A and B. A included information about study sample size in the method. B did not include sample size information in the method. Sample size information is in your results. Okay, so let's go ahead and read the result of researcher A. Researcher A tells us that 494 respondents had heard about PrEP through community dialogues, and 439 supported its use. Fewer than half of the respondents were aware of clinical care required for PrEP, and misconceptions about PrEP were common. Stated barriers to PrEP uptake were stigma, cost, frequency of HIV counseling and treatment services, possible drug-drug interactions. There were concerns about condom migration, increased risk for STI and pregnancy by female sex workers, and poor adherence to medication and hospital schedules. Participants felt that trained peer educators and HIV test counselors could provide information and refer clients to clinics that provide PrEP, and that PrEP could be provided through peer-led facilities, though its access should expanded to all persons who are substantial risk for HIV to prevent HIV negative labeling. And it recommends that public awareness about the use of antiretrovirals for HIV prevention is needed to prevent labeling. I'm going to critique this. One, you would look at the report. This individual has reported that the respondent heard about PrEP through community dialogue. That was not a study objective. There was no study objective that asked, how did they hear about PrEP? But he goes on to write it in the results. He says 439 supported its use. There is nothing about that in the objective. It's not an objective. It says fewer than half of the respondents were aware of clinical care. This is not an objective. And says misconceptions about PrEP was common. It's written 4 statements that were not objective related. And the others do not align properly. Let me move on to researcher 2, reporting the same thing. The researcher 2 started by stating the study sample size, 591 MSM and female sex workers participated on the online survey. This number participated in the focus group discussions. 65 policymakers participated in the workshop. The sample size are clearly defined. It then went on to report on the responses to address the objectives. This number identified the need for, this number supported it, this number felt there was barrier to uptake. And this identified stigma, cost, frequency of counseling, and drug-drug interaction as possible barriers. Concerns that was a study objective included possible condom migration, increased risk for STI, poor adherence to medication and hospital schedules, increased risk of pregnancy for female sex workers. Challenges. Respondents felt the challenges could be addressed by trained peer education, HIV test counselors to provide information about PrEP and referring clients to clinic that provides PrEP. PrEP can be provided through peer-led facilities for MSM and female sex workers. PrEP should be provided to all persons at substantial risk to prevent the negative labeling. And lastly, public awareness on the use of antiretroviral can prevent labeling of users of PrEP as people living with HIV. If you see researchers B, researcher B has tried to address the study objectives with clarity. That's different from researcher A. Finally, researcher A concludes, although MSMs and female sex workers are interested in the use of PrEP, numerous individual and structural barriers need to be addressed to facilitate access to. Remember, you have to write 2 sentences. The first one is the answer to the study objective. There is no answer here before you then write your recommendation. This is the conclusion for researcher B. Researcher B says the majority of female sex workers and MSM identify the need for PrEP for prevention of HIV. The barriers and challenges to PrEP access can be addressed through the training of providers, expanding access of PrEP to populations beyond female sex worker and MSM, and public awareness cooperation. And then the recommendation, further studies are needed to develop models. So this is trying to show you examples of what it is to write. The abstract that is talking about lessons learned are those that shares field experiences and are best handled using a qualitative analysis. The best advice is to cluster your lessons learned into teams and report your teams using a theoretical frame. It becomes more powerful. When you don't do that, it becomes a story and you lose marks. So this is, for example, the lessons learned, okay, kind of abstract. Rather than report, background, the structure where we have which results, we'll notice that we observed that MSM and female sex workers face structural challenges, and then he groups the structural challenges: stigma, poor quality of HIV counseling, and individual challenges, and biological challenges with uptake and use of PrEP. So this is what they write in their lessons. They cluster their findings rather than write it up loosely. And that gives it power because you're looking at the clustering through a theoretical framework. Use your clustering through a theoretical framework. It becomes more meaningful and more powerful. And then this individual goes on to write that the structural and individual challenges were minimally reported at PrEP service points provided by peer-led facilities for MSM and female sex workers. Biological barriers were reported for discontinued PrEP use for the majority of participants in both peer-led and facility-led facilities providing services for MSM and female sex workers. PrEP service points that provide individual counseling were less likely to report PrEP use discontinuation, blah, blah, blah. This is a more powerful way of presenting your lessons learned than writing it in long stories that are not structured in a way that projects your finding powerfully. If in your methodology, you clearly define that your lessons learned is using a theoretical frame, you would likely get scored in a way that you can present an oral abstract. These are common flaws we have found in abstracts. The most common is backgrounds that have 5 to 6 sentences. The background takes half the abstract. Imagine you write half the abstract and it's just 1 mark. Very poorly stated objectives. When the objectives do not link with the methods of the result of the conclusion. When you write up a method, that gives room for suspicion that the work was not done. And this is worse when you write the results that does not have figures. Everything is 100, 200, 500. You write a mean, there's no standard deviation, and you can't find links between them. You say you conducted analysis, you do not write your confidence interval, you adjusted odds ratios. The other thing we find as a flaw is when the recommendation is not linked to the finding. The recommendation is just out. And the worst is when there are grammatical errors. It makes it difficult to read. And your reviewers are human. They therefore might take it out on the marks. Before I take my final words, I want to defer to Luke. Luke, do you have any scores there? Do you by any chance have any scores, Luke?
Yeah. Hello? Prof.
Yes, we
Morenike.
can.
Yes, we got
Yes.
some stuff here. We have 1.5 over 5.
Very good. So that was for abstract A, and you here scored and got 1.5 over 5. In
Exactly.
effect, this researcher A, despite what seems to be a beautifully written abstract, did not make it to the conference. It didn't even make it to poster. 1.5 over 5 would not make a poster presentation. Thank you very much, Luke. Gordon, what did you score, researcher B?
4.7.
4.7.
Over 5.
So researcher B, having written exactly what researcher A wrote, but followed the principles that we have taught you now, you, the audience, scored researcher B 4.7. Researcher B would very likely have an oral presentation. In effect, you, the audience, have judged that if you can follow the outline that we have shared here with you, it is very likely you would score very high and get your abstract in first, and then we might get an oral or a poster session. In our final words, please once again know that abstract writing is a skill that you can acquire. We've shared with you the simple logics to what's writing a good abstract. It's all about you learning how to write. And we have shared with you the basic ABC of writing a good abstract. Everybody acquires new skills. Please note that if you do not have the skills before, this is new skills. Please acquire them. As always, acquire new skills. But once again, your researchers, be aware that it's your responsibility as scientists to protect the integrity of science. You have a role to play in protecting the integrity of scientific writing. Only share with us what is true. Do not cook up figures. Do not cook up information. Many times your abstract is referred to in the future because we publish it. It is important that you only share with ICASA and any conference where you submit an abstract to facts, not false information. And finally, please, you could Google the stroke checklist on conference abstracts. You would find out that what I've shared with you today through the SAR platform is an internationally acclaimed guideline for conference abstract. This is the same guideline that is used in every international conference around the world. Once again, ICASA abstract is open, and we are open to July 31st, 2023. Thanks for listening, everybody. Over to you, facilitator, moderator. Thank you.
Well, many thanks to Professor Morenike. Okay, let's move to French now. Ok, je pense que ça a été un exposé très enrichissant. J'ai noté quelques questions et je vais essayer de les partager à l'oratrice pour apporter quelques éléments de réponse. Ce sont des préoccupations des participants. Alors, premièrement, est-ce qu'il y a un participant qui voudrait savoir, est-ce que l'abstract, une fois qu'il a été soumis ou qu'il a été publié au décours d'un congrès, est-ce qu'il a une durée de validité? C'est-à-dire au-delà de laquelle on dira que les données sont caduques et que ça n'a plus de valeur. Première question, pardon. Et dans la même foulée, est-ce qu'il y a un nombre requis de mots pour figurer dans un abstract? De manière, on va dire en moyenne, voilà. Est-ce que le professeur Morenike peut déjà répondre à ces deux questions-là? Ensuite, il y en a d'autres. Hein. Ou alors, je continue à peut-être prendre des notes pour répondre à une série de 5 questions. Après, je passerai encore aux 5 suivantes. Alors, troisième question. Est-ce qu'on peut évoquer encore des résultats sous forme de données chiffrées, pourcentages et tout ça dans la conclusion? Ça a été donc
Prof, you're going to have to interpret to English for me. I don't have the interpretation yet. Apologies, yes. Thank you. But if you want me to read directly from the question and answer box, I can do that.
Okay, if you want. Maybe
do you want me to do? Do you want me to do that?
It will be more simply, yes. Okay.
Okay.
Go ahead.
All right. So there's a question from Blair that says, how long should an abstract typically be? And are there any word count restrictions? Usually, for conferences, abstract presentation is usually about 300 words to 350. Some might say 200. Usually, you would have 300 to 350. Very rarely would you have 500 or 200. So it is expected, I would advise that within that structure, your methodology just has to take the big chunk appropriately. And if you can follow the guide, it's very likely that you would work well with writing less than 300 actually. Andres here says, when using secondary data for implementation research abstract, some variables are missing at the register, like marital status, income, and religion. Could it enough to assess the predisposed determining factors using the available variables? You're very right, Andres. These are the challenges with secondary data analysis. You would many times have missing variables. You would, however, use what is available, noting when you have given your full presentation, the missing variables, the limitation with secondary data. The best thing that would save you with the abstract is to write it in your abstract method, that this is a secondary analysis of your primary data collected for this. You definitely must have your independent and your dependent variables to start to do the analysis. When you now have to do the full presentation, you would now make it clear that you had challenges with your confounding variables. Your dependent and independent variables must be present for you to start on that study. What may be missing may be the confounding variables. And you're stating this clearly when you have your presentation, then it helps us to do the limitations of what we had doing. I will take one more question in English. I'm going to defer to Professor Tanon. So please help me read out the French questions and please do interpret that to me. There's a question from Bonza that says, can we conclude our research findings in percentage? Excellent questions. The best way to, the right place where your figures should be is in your results. You do not find results in the conclusion. Your conclusion should be narratives, kind of interpreting the finding in a meaningful way for us to take forward. your findings usually would not contain figures. Thank you very much. Over to you, Professor Tanon. I think there are French questions. I will defer to your help to help me interpret them.
Oui, merci beaucoup. Il y a deux questions, peut-être dans la foulée, hein. Est-ce qu'on peut surligner, c'est-à-dire highlight the data in the result oui. Non, c'est-à-dire dans la présentation des résultats, est-ce qu'il est besoin de surligner ou de mentionner? C'est-à-dire en termes d'écriture, on met certains mots en gras ou non, voilà, des choses comme ça, pour montrer au lecteur que oui, voilà ce qu'on a trouvé en fait. Est-ce que c'est nécessaire? Non. Je pense que non. Professeur Morenike.
Yes. Did you answer the question?
OK, très bien. Donc, c'est non. La réponse est non. Alors, autre question. Lorsque la taille de l'échantillon n'est pas calculée, parce que dans certaines données statistiques, il y a des formules mathématiques pour calculer la taille de l'échantillon. Mais lorsque on n'a pas de calcul, de règles pour calculer la taille de l'échantillon et qu'on se base sur des données de prévalence dans notre contexte, par exemple, qu'on fixe arbitrairement notre échantillon à 40 personnes, est-ce que les résultats sont valides? Est-ce que c'est une étude qui a de la validité?
I'm sorry, I didn't understand that, but I assume, did you answer the question? Professor Tam?
Non, c'était une question, en fait, une préoccupation d'un des participants, parce que c'est vrai que si on veut suivre donc les normes ou les règles pour écrire une bonne méthodologie, il faudrait que la taille de l'échantillon soit calculée. Mais lorsque on ne peut pas calculer, qu'on fixe arbitrairement un nombre comme ça, est-ce que ces résultats-là qu'on va présenter ont de la valeur? En fait, c'était la préoccupation du participant.
Okay. No, interpreter, please, can you say that again? I just got you. Please, can you repeat that? I'm very sorry. I'm really lost. Can you repeat what he said, please?
Tu transmets.
Okay.
C'est bon? OK.
There? Allô, prof?
Oui, c'est moi qui traduis ou je pensais que quelqu'un d'autre le faisait?
Oui, mais apparemment, le professeur Morenike ne suit pas très bien. Elle n'a pas le casque. Morenike, are you there? Allô, prof, are you there?
I'm here. Yes, I'm here.
C'est bon?
I'm here.
OK.
Prof, Tanon, question?
Yes, Professor Tanon was speaking in French, and I'm asking, I didn't hear the interpretation, so I said he should repeat the interpretation.
En fait, c'est très faible la traduction. Je ne sais pas, apparemment, elle comprend.
Professeur Tanon, est-ce que tu peux interpréter directement? C'est pas mieux?
Yeah.
Moi, je vous entends bien. Moi, je vous entends très
bien. OK, alors, interprète directement la question en anglais.
Ah, OK, d'accord. Donc, vous ne recevez pas la question. Bon, alors, je vais peut-être traduire pour elle aussi simplement que je peux. When the size of the population can't be calculated with
Yes.
is it available to make a size, comment dire ça?
To just make up the sample size.
Yeah.
Okay, so
and the results are available or not if I do like this?
Okay, is the results valid? I think that's what I'm. So for my interpretation is that if there is no sample size, if there's no way to calculate the sample size and you just make up a sample size, is this result valid? I hope that's what I heard. One, sample size is very important. Sample size calculation is critically important because your sample size tells us the power of your study to be able to answer the objective. When sample size are not calculated, then the results becomes non-reliable. We can only say it's telling us or pointing us to something. There are various statistical size calculation mechanisms that you can use. Even when the prevalence is not known or the proportion is not known, there's sample size to use to calculate this. When a sample size is too small, you are going to underpower. If you have too large a sample size, you're going to introduce error. So sample size matters. Right. Apart from the fact that there are ethical issues with oversampling, you introduce a type of error that also becomes a problem. So there is always everything to answer the problem about your sample size. Even if there is not existing, there's a sample size calculation for when prevalence is not existing. I did see also a question in the chat box that asked about the length of the abstract. Please note that the length of the abstract of 200, 300 work is the whole abstract, not just the methodology. Okay, thank you. Let me see if there's any. Yes, the abstract presentation I did here today is applicable for when you're also writing a manuscript. Very, very applicable. Thank you. If you, yes, you can submit an abstract on best practices using the lessons learned approach that I had also shared. And when you are talking about cross-sectional studies, the best relationship is associations, not trends, not effects. Cross-sectional is associations. The relationship you're looking for is associations. Thank you very much, Over. I apologize for those who wrote in French. I will defer to Professor Tanon. Please help out with those that have questions in French. Thank you, sir.
Okay, one more question, please. It is written in French, but I'm going to translate. Is there a role to write the authors of an abstract? Maybe when many structures are contributing in the same study, how to write the name of authors? Is it a rule for that?
When many people have contributed to a study, please there are guidelines as to how to write the names of the authors. Usually, the person who conceptualized the study usually should be the first author. And thereafter, where possible, include their names according to the level of contribution or based on, a defined mechanisms you have all agreed. But there are two things that seems to be a standard. The first person is the person that conceptualized it. Your mentor may take the second place or the last place. But please, in terms of the order of listing, it must be a consensus reached by everybody. Thank you, Over.
Thank you. Okay. Je crois que je n'ai plus de questions.
Alors, Professeur Tanon? Oui, si vous permettez.
Alors la plupart des participants souhaiteraient avoir donc soit la présentation ou bien un lien pour pouvoir consulter donc la présentation après.
OK. Allô, Professeur Tanon?
Voilà.
Allô, Professeur Tanon? Oui. Bien sûr, après la...
Voilà, je pense que le message a été bien entendu par les organisateurs de ce webinaire.
After this webinar, we will share the...
Voilà, là, je vais passer maintenant la main à M. Luc Baudéa pour conclure donc la session. Je pense qu'on arrive à la fin pratiquement.
Thank you, Prof. Tanon. After this webinar, we will share the recording of this webinar, and also we share also the slide of Professor Morenike. In fact, you can we don't know how to thank Professor Morenike. It was a wonderful presentation. And I hope that all our viewers really enjoy it. And it will help to improve the abstract that we are getting at ICASA, especially the upcoming ICASA 2023. Let me also take the opportunity to inform them that at ICASA, the number of words to present your abstract is 500. And it's including everything, both the methodology, the presentation, everything, 500 words, you know.
Also
And
the name of authors or no? The name of authors.
Including everything included, 500, yeah. And we are closing, as the Prof mentioned, we are closing the abstract portal. We are closing it ending of July. Please, I will invite you to please send your abstract on time. You have the methodology from Prof. We will share with all of you, and make sure that you send it on time, because we are not at ICASA. We don't handle a break later abstract. Late breaker abstract, we don't do it. No, this is why we give more than 3 or 4 months for researchers, you know, to send the abstract on time. Thank you so much. Over to you, Professor Morenike.
Merci beaucoup, Professeur Morenike. Merci à Sarah. Merci à chacun. Donc, le dernier mot, je pense.
Morenike.
And thank you. God bless. Looking forward to you reading your abstract as a reviewer. And I wish you success going forward. Thank you for the very nice words. Have a wonderful weekend. Bye.
And what is the next steps, please, before ending?
The next step is that we are discussing with Professor Morenike to have also her time, because she's very busy, you know, so that we can host this webinar again in July before we close at a platform. Yeah, that's it. That's the next step. And I will also invite the president of SAR, if he's there, you know, to give the closing remark. Professor Morenike, are you there? Hello, Prof?
Yes, sir. I'm here, sir.
Okay, sir. Then, Prof, please, you have the last word before the professor, before the president of SAR will give his closing remark. Thank you.
Yes, I commit to Mr. Luke's decision. When we have a July call, we'll send it out, and I'm willing to repeat this. Most likely next time we would do half and do a lot more time taking your questions, rather than the full presentation. Thank you. Bye.
Hello, Mr. President, are you there?
Yes, I'm there.
Please, you have the floor, please.
Thank you very, very much. Well done, Professor Morenike. I really saw that this was a well-structured, very clear presentation. And from what you could see from the reactions of the participants, there's an overwhelming request for sharing of the slides and the presentation to them. And as you can see, you have really taken SAR to another level. We hope that, like what Luke has said, that you will be able to present another webinar of the same caliber, perhaps in July. I would like to thank also Professor Tanon for his very professional moderation and his commitment to have been on this webinar for this long. Luke and your team in Ghana, you have done very well to actually facilitate this particular presentation. So on behalf of SAR, the caliber of, I just want to remind everybody, that every participant, that they should register to come and participate in ICASA 2023 in Harare between the 4th and the 9th of December this year. So with those few words, really, I want to thank everybody. This was really brilliant. Thanks, Prof.
Thank you, sir.
Thank you.